Hey everyone, my name is Taylor Demars, and I'm going to be talking to you all about returning to run when you're coming back from a baby. So our goals for today over the next 10 to 15 minutes, we're going to talk about when you should return to running postpartum, why you should take some steps to prepare your body to return to run, how you should do it, and then what a typical timeline looks like and what are some expectations that you can have when it comes to that timeline. So a little bit about me before we jump into what we're going to talk about today. Like I said, my name is Taylor. I am a physical therapist. I work for Peak Endurance Performance in physical therapy. I have two little kids that you see there on the screen, Eli and Dylan, and a third on the way. And I am a runner as well. So that other picture there is me and my husband running together. It's something that I really love to do and learned a lot when I came back from running, especially after having my first baby. And it's something that's made me really passionate about this exact topic that we're going to talk about today. And one of the reasons that I want you to understand how important it is to really prepare your body to return to run so you can try to avoid some of the mistakes that I ran into. So, should you return back to run at that 6-week mark? I think we all hear this. Anyone that has been postpartum, it's 6 weeks, you go back, you typically have an OB visit, and you get the all clear to start to return to activity. This does not mean we should jump back to running. This 6-week mark, it's not a magic number. Nothing physiological happens at this date. It's not like you hit the 6-week mark and you're fully recovered. You've gone through all of your healing that you're going to go through, or you have all your strength back at 6 weeks. We're getting a lot of new research now, which is awesome. That's demonstrating the importance of waiting at least 12 weeks. And there's always going to be exceptions to this rule. Some women are going to heal faster. Some women are going to get their strength back a little bit quicker and maybe be able to get back to running a little bit sooner. And it might take some women a lot longer to get back to running, depending on what their birth was like, what their sleep is like. There are so many factors that play into it. So using time as when you should return to run isn't always the best thing to do, but we can start to understand through our body's healing process that typically we should wait at least 12 weeks. So why not rush back at the 6-week mark? We need adequate time to heal. So when I talk to clients that I work with, I liken it similar to a surgery. If you had your ACL repaired, we wouldn't just say, okay, rest for 6 weeks, don't do anything, and then start running. That's not how it works, right? We give our body time to rest and heal, but then we also prepare our body for the demands of running. We don't just go from 0 to running. We also understand that certain hip muscles and certain core muscles have decreased strength postpartum. Does not matter if, for example, you were able to run the day you gave birth, or you were able to continue to strength train right up until delivery. Unfortunately, you're still going to have some deficits postpartum. So the research shows us this. Our muscles have gotten stretched out. They have been carrying the load of the baby for 9 months, and then they go through this huge delivery process and labor, and they're going to be weak after postpartum or during postpartum. We also know that our pelvic floor and our abdominal muscles and their connective tissue and their nerves are going to take at least 4 to 6 months to heal and allow to maximize their strength. So why should you prepare your body to return to run? Why is it important that we just don't go from complete rest to running? Well, running is a high impact activity. It requires strength, it requires balance, and it requires your body's ability to be able to tolerate impact. And all of these areas can be decreased postpartum. So it's important that if you're able to meet these certain criteria, as well as follow a return to run progression, This can really decrease your risk for soft tissue injuries, for bone stress injuries, and really allow for a much more enjoyable running experience. You might be able to start running for a few weeks, maybe a month or two. But if you're not doing certain things to address your deficits, then you're likely going to run into some symptoms down the road, whether it be leaking or prolapse, or even musculoskeletal injuries. Like, you don't want to get sidelined by knee pain that could have been prevented if we were doing some work to prepare our bodies to run. So what can you do to help yourself prepare to run? So I had talked a little bit about how we should wait a little bit longer than that 6-week mark, thinking more around that 12-week mark to start back to running. But that doesn't mean that you can't do anything, right? So what can you do? You can work on strength. So strength training is super important. You can work on any balance issues that you may have, and then work on impact tolerance. So getting your body ready for that impact that running offers. Sleep, there is a question mark by sleep, because obviously postpartum, our sleep is not consistent. We are getting woken up a lot. And so it's just something that we need to take into account, doing our best, sleeping when we can, but also knowing that returning to run might take a little bit longer than we expected. So when I work with clients who I'm returning to run after a musculoskeletal injury or surgery, their return to run can be a lot more regimented, and we kind of know what to expect when it comes to time. But when we are postpartum, there is so much more that goes into our recovery and our return to run than just the first three there, the strength, balance, and impact. We also have to think about what our bodies are going through and the demands on our bodies and the lack of sleep we're getting. That can really play a role in recovery. So it's just something to keep in mind, that you might not get back as fast as you were expecting. And then the last two there, also important to try to prepare yourself to return to run: nutrition, making sure you're getting the calories in that you need, as well as recovery. So I think it's, at least for me and for some of my clients that have gone through this postpartum return to run process, it can be, you have goals, right? We have things that we want to accomplish postpartum. We want to get back to running. We have things on the calendar that we want to do, but we also have to remember we can't skip steps, right? Our bodies need the time to recover. And so we need to plan in rest days as well. So how should you go about returning your body to run? Well, you can take yourself through a readiness screen and trying to see some areas that maybe you should work on addressing. So I'm going to go over a readiness screen that I take my clients through when I am trying to get a good idea of kind of where they're at and what they need to work on before they start that return to run. So looking at strength. So a wall sit, just a general assessment of lower extremity strength, sitting in a wall sit for at least a minute, holding a full plank on your elbows for a minute, and then a side plank as well, full side plank for 30 seconds on each side, as well as a single leg bridge. So holding that single leg bridge, can you do that for 30 seconds? And then looking at a step down. So this gives us really good insight into hip strength as well as that pelvic control. So a single leg step down, 10 reps, as well as a heel raise. So looking at calf strength, can you do a single leg heel raise 25 times? So that is the strength component of the screen. You can check out your balance. Balance is something that can be impacted postpartum. Our foot structure can change, which changes our balance, as well as our center of mass and our center of gravity has also changed. So looking at your balance, standing on one leg for 20 seconds, can you do that easily? You can make it a little bit harder as well if you stand on one leg, eyes closed for 20 seconds. And then looking at your impact. So can you tolerate hopping in place on 2 feet for a full minute? And the beats per minute there, so it says 150 beats per minute. That is the cadence that I want you to hop at. So if you set a metronome on your phone, you can kind of hear how quick that cadence is. And that is the beat that I have women jump to. So can you hop in place for 60 seconds? Can you hop on 1 foot for 30 seconds? And then can you tolerate running in place for 60 seconds at a little faster cadence, so 170 beats per minute? This gives you a good idea if you have any symptoms, whether it be pain, leaking, pressure with impact. Is that an area we need to address as well? So you can take that screen, you can put yourself through that screen, and then you can address what you find. So this is an example. So say you took yourself through that screen and you found the side plank to be really challenging and the single leg step down to be really challenging. And typically, if you are postpartum, these two things are going to be hard. You can just turn that into your strength program. So 2 to 3 times per week, go through those exercises, 2 to 3 sets, and kind of meet yourself where you're at. So everyone is going to be different. Some women have time to do or are really motivated and they really want to do 4 times a week and do a ton of exercises. Other women, it's like I have 5 minutes and I can only do 2 to 3 things twice a week. That's fine. Just know your time to see progress might take a little bit longer. Also integrate what you like to work on. So if you were challenged with that side plank and the step down, we're thinking decreased hip, decreased core strength. Pick your favorite exercises that are challenging because those are going to be the ones you most likely do, and integrate those into your program. Just a few examples here. So if we're thinking about hip strength, where can we start and where can we go? So a bridge hold, 2 feet or 1 foot. If that step down is really challenging, you can shorten that range of motion and turn it into a little mini step down. Standing march, a goblet squat, and then a step up. So those last few exercises are a little bit more challenging, but that's an example of kind of where you can start. And then as they get easy, progress it to where you're doing squats and step ups, and then eventually adding weight. Examples of core work, planks, seated twists, and then butterfly sit-ups, which are on the more challenging end. All of those are really great exercises if you're looking for some ideas. So what about running? So you've taken yourself through that criteria. You felt really good, you felt strong, or you've been addressing and working on your deficits. It's past that 12-week mark. Now what do you do? So we want to do a running progression. We don't just want to jump back to running for 20 minutes or running for 3 miles because that's what you were able to do before. We want to make sure it is a slow progression. This is going to allow for graded exposure to load. So it slowly is going to let your body adapt to the load that running puts on your body, as well as it allows you to monitor symptoms. And we already touched on this a little bit, but postpartum is different than when you return from your typical overuse injury or even a surgery. We need to think about we need to think about ourselves in a little bit bigger picture, not just I did my strength work and now I can start running, right? We have to take into account that if you're breastfeeding, the demands on your body are high. What does your nutrition look like? Make sure you're getting in enough calories. And then what does your sleep look like? So some women at the 12-week mark are having great full nights of sleep. Other women are still getting up 3-4 times a night. So it's just something to take into account when you're talking about going back to running. Like, what does your life look like outside of running? So what is your progression? You want to talk about or think about doing a walk run interval program. So there's a lot of different programs out there, but you want to start more walking than running and then progressively take that walking away as you add in more running. Start with time over distance. Don't be afraid to repeat. So for example, if you're doing a 30-minute run and you did 3 minutes of running, 2 minutes of walking, you repeat that 6 times to equal 30 minutes. Say that day didn't feel great, or maybe you had a few leaking symptoms with that day. Take a day off, and then don't be afraid to go back and repeat that day again. Again, going back to, it might take you, say the return to run program you're doing should have you back running 30 minutes in 4 weeks. Know that it might not look like that, depending on, again, those sleep, nutrition factors. Just give yourself time and don't be afraid to take a little bit more time than you think you need. And also continue with your strength training. This is going to help you build that load capacity. So timeline. What does this look like when you think about it? If you're someone that is currently pregnant and is thinking about, okay, when can I start running again? So we typically think about that 6-week mark, starting to really dig into our strength training and develop a really good, strong strength program. And then anywhere in that 6 to 12 week range, maybe initiating a walk run, depending on how things are going. When we hit that 12-week mark, thinking about progressing more towards a continuous run, as well as continuing strength training. And then when we're post that 3-month mark, we want to think about progressing our volume, maybe your frequency of running, and then building a really good base to allow yourself to build off of. So going back to the goals that we talked about at the very beginning, when should you return to run postpartum? Time is going to be different for everyone. Typically the earliest you can think about is about 12 weeks postpartum. Why is it important to prepare your body for that return to run? There are plenty of postpartum changes that happen that we want to address, and it just allows for a much more smoother and enjoyable return back to run. How should you go about preparing? Strength training, as well as a walk run progression. And then when we think about, like, what does that timeline look like? It's going to be different for every woman, but thinking about starting with some strength in the early phase, walk, run, then a run, and then thinking about building that run by increasing your volume, your frequency, and then lastly, increasing the intensity of that run. So if you have any questions after listening to this, please feel free to email me. My email is there on the screen. And I can also send you this PowerPoint if you just put return to run postpartum. But thank you very much for taking the time to listen to this. And I hope it helps you have an enjoyable return to run postpartum.